Good afternoon, and thank you for joining us. You're watching Ask Us Anything About Knee Problems. My name is Barbara Shindo. Today we are going to talk about knee pain, knee problems, treatments, and everything you need to know if you have, sore knees or hurt knees from either aging, stress, or perhaps an athletic injury. So statistics show that about 1 in 4 adults report that they suffer from knee pain, and we are going to talk today about knee pain. And I'm fortunate today to be joined by 2 experts. We have 2 orthopedic surgeons from Penn State Health, Milton S. Hershey Medical Center, joining us this afternoon. Dr. Charles Davis and Dr. Aman Dewan are both with us today to talk about knee pain and to answer your questions. So we'll get started here. But if you are watching this with us live on Facebook, or if you're watching on playback and you have a question about knee pain for Dr. Davis or Dr. Dewan, please put your questions in the comment section below this video and we will get an answer for you. So Dr. Dewan, Dr. Davis, thank you so much for joining us this afternoon. Let's start with some basics, and the 2 of you have a little bit different areas of expertise. So what we're gonna do today is Dr. Dewan will be our kind of expert in sports-related medicine, sports injuries, and Dr. Davis can talk more about, arthritis, aging, day-to-day stress. But they're both here to help us out. So again, thank you for joining us. And let's start with one for you, Dr. Dewan. Let's talk generally about knee pain. What can cause knee pain in younger folks or young patients and athletes? What might be some causes of knee pain for them?
Yeah, so knee pain is, as you mentioned earlier, very, very common in all age groups. And I think probably the most common cause, especially in younger athletes, grade school, middle school, high school, adolescent athletes, is usually overuse, typically a tendinitis phenomenon, either the patellar tendon or quadriceps tendon. Most causes of knee pain in that age group, I would say, are overuse and typically a tendinitis.
Okay, thank you. And Dr. Davis, let's talk a little bit about knee pain. What are some causes of knee pain in the older aging population?
Yeah, so it's a little different in the older population. It tends to be a lifetime of heavy use. So arthritis, which is a wearing away of the joint surface, tends to be the most common thing that we see. Sometimes you can get some bursitis or some tears in the cartilage, but for the most part, arthritis, osteoarthritis is what we're talking about for older folks.
Okay, and for that population, Dr. Davis, what are some things they can know about preventing knee pain?
I think similar to what Dr. Dewan talks about is avoiding overuse things. It takes longer to recover from those things when you're older than when you're younger. So if you're going to start a new exercise program, start slowly, gradually build it up, and use some moderation when you're doing that. But we still want people to be able to be active and exercise and enjoy their lives and their families. They can sometimes take Tylenol or ibuprofen if things get a little sore, and then just take it a little easy if it starts to hurt you, and that can take even a few weeks for it to calm down.
Okay, so going from there, I made a note when Dr. Dewan said overuse as well. So that seems like that's a pretty common cause in any age group. But how will somebody know if it's just overuse, that maybe they need to take a break from working out or take it easier, or when they should call a doctor and see somebody about their pain?
Yeah, no, I mean, that's an issue that I think I see every day while I'm in clinic. And, certainly to start with, is this traumatic and acute in onset? Did it occur with some sort of twisting injury or a fall or some sort of collision, versus more insidious in onset, more gradual? That can be a cue. Obviously, things that are more acute and traumatic can be more concerning for a more structural and a deeper injury than just overuse. Certainly things like the pain is getting worse with rest, ice, elevation, anti-inflammatories, activity modification. That's usually concerning. If you have difficulty with weight bearing, if you start getting swelling, so swelling inside the knee, if the knee starts looking like, a soccer ball or a basketball, and there seems to be a lot of fluid on there, that's a very quick indicator or very prime indicator that something is amiss. And usually it's something structural within the knee. Doesn't necessarily mean that you need surgery, but it does mean that you should get this looked at by a physician.
Okay, thank you, Dr. Dewan. And that actually was a very nice segue into my next question. You said, you don't always need surgery. So let's talk a little bit about the treatments for knee problems or knee pain. Let's start first with what are ways to treat knee pain without surgery, and then kind of move on to when do you start to consider surgery and when is that necessary?
Again, I think for most patients, for older patients, it's a little bit different. Usually you can keep an eye on things short of a really major injury, a fall, getting hit by a bike or a car or the dog knocking you down. Most of the time for older folks, you can keep an eye on it for a few days or even a week or two, and it should gradually begin to calm down. As Aman said, if it's getting worse, then you should let us know. If you really can't walk on it, then you probably need to come in and be seen. But if you're kind of getting around, and you could give it a few days or a week, there aren't very many things that are really emergencies. Of course, we're happy to see you urgently if you need us to, but most of the things are not true emergencies that you have to come immediately. It's not going to get worse by waiting a little bit. Things that help are icing it, ibuprofen, Motrin, if you can take those kinds of medications, Tylenol, and again, just moderating your activities to see how things go.
So if those treatments aren't proving to be helpful, then is that when you start to consider surgery, or what makes you as the provider start to think maybe they need surgery?
Again, I would think that's when you certainly should be evaluated. If those things aren't working, you certainly should get checked out. For the older, sometimes we can do steroid injections into the knee, so the steroids act as an anti-inflammatory, take down some of the pain. So we can do that sometimes. So there's still some non-surgical things that we can do. But it is, if you're still having trouble, then it's worth getting checked out.
Okay, great. And you are watching Ask Us Anything About Knee Problems. I'm here with two orthopedic experts, Dr. Aman Dewan and Dr. Charles Davis. Both are orthopedic surgeons at Penn State Health Milton S. Hershey Medical Center, and they are here to answer your questions about knee pain. So if you have a question for Dr. Dewan or Dr. Davis, please put that in the comment field below this video, and we will get an answer for you. So let me ask a question to both of you that you probably do get a lot from your patients. Folks who want to stay active while they are, either have a knee injury or recovering from a knee injury. What kind of things, Dr. Dewan, you had mentioned that you work with a lot of younger folks and athletes, so they probably want to keep working out, even though they maybe should be taking it easy. So what kind of things do you recommend to those patients?
Yeah, absolutely. So, I mean, in general, if you have pain with working out, if you have swelling with working out, that's usually a signal that your knee is probably not happy with something that you're doing. It doesn't necessarily mean something's structurally wrong, but it definitely means you got to change maybe the way you do things. And some tips, for instance, I've had surgery on both my knees many years ago from sports injuries. And so there are certain workouts, like for instance, high impact exercises that bother my knees if I do this consistently. So I myself have had to find ways to work out differently. And you'll hear this term low impact quite a bit. And what does that mean? It just means that the contact stresses on the cartilage in the lower extremities, your ankles, your knees, and your hips are seeing less impact, less force, which tends to create less irritation and less wear and less discomfort. So what are exercises that are low impact? Well, those include things like elliptical trainer or cross-country machines. Swimming is an outstanding exercise and one that I like to participate in. It's a great upper and lower body workout. The water tends to really decrease, obviously, gravitational forces, and swimming tends to, the buoyancy tends to decrease the stress on your joints, especially your lower extremities, and is a great way to work out for people that have knee pain or knee issues, whether they be younger and or older. I get the question a lot about walking. Well, what about walking? Well, interesting enough, while walking is kind of better than running, the contact stresses are less than in running. They still are fairly quite high, and people with knee problems can have significant pain and discomfort with long periods of walking. So while not absolutely forbidden, there are other ways to kind of be more gentle with your knees and your lower extremities in general and not have to see a lot of those forces. So walking better than doing nothing. There are other ways to still exercise, still work out, and still maintain fitness despite knee issues.
That is really interesting. You would think walking is not going to cause any kind of issue, but I see what you mean there. But I have heard, a lot of folks say that running can be very tough on the knees over a long extended. If you've been a runner for years, that can be very, very hard on the knees.
I think that's one of the big changes really in the last 15 years or so, Barb, is much more emphasis on getting people back to high level activity and more quickly. Certainly, in the older folks in the joint replacement world, that's true. And I think for the younger patients as well, people have different expectations now, and people want to be skiing and playing tennis and doing other somewhat demanding activities after their knee injury has been treated. And so I think we started to stretch the indications of what we'll let people do after some of the treatments that we do. And that's been a real focus over the last several years. And I think that's been quite effective for folks and has really helps them out with their lives.
Yeah, I bet patients are very happy to be getting back faster to the things they like to do, even after, a big injury or possibly even having to have a surgery. Dr. Dewan, you said you've had multiple knee surgeries. And Dr. Davis, I know that you do specialize in knee and hip replacements, right? So can you talk a little bit about, if that's what you need to have, if your knee problem is the solution, if the solution to your knee problem is having a knee replacement, what is that process like? What do patients need to know?
Yeah, so usually, first of all, we want to be sure that you've tried the non-surgical things as we talked about. So only do the knee replacement really as a last resort if all those non-surgical things haven't worked. But knee replacement is a very good and reliable operation. Not everyone's perfect. It can last a long time. And our goal, again, is to get people back walking pretty quickly, get them back to doing things with their family, whatever is important to them. Some folks playing golf is really important. Some folks want to go to Hershey Park with their family. And that's what we're really trying to achieve. The recoveries are a lot better than they used to be. And so that's really been the big improvement in the last 10 years. So most people are in the hospital no more than overnight. And maybe even 30 to 50% of patients can now go home the same day. So that's a big change from years ago. And that's just because we've made the recovery a lot better. And so folks don't have to be as afraid of the recovery as they used to be. Certainly knee replacements hurt, and it's a process to get over it, but it is better than it was a few years ago. Overall, it takes 6 to 12 weeks to really totally get over it and get back to your lifestyle. But then they can last 15, 20 years and work really well for folks. So it's a great operation. Again, not everyone's perfect, but most folks do really well. And folks can play tennis, they can ski, they can walk. So they can do lots of things with their families and for recreation.
Okay, great. You are watching Ask Us Anything About Knee Problems. I'm Barbara Shindo here with Dr. Aman Dewan and Dr. Charles Davis, both orthopedic surgeons at Penn State Health Milton S. Hershey Medical Center. If you have any questions for either of them, please feel free to put your question in the chat, whether you're watching this with us now live or if you're watching this on playback. If there's something we haven't discussed that you still have a question for either of these doctors, we will get an answer for you. And also, please feel free to share this video. As we have talked about, knee pain and knee problems are fairly common. So there's probably somebody in your life who may need this information. So please feel free to share. So let me get into a little bit of myth busting. So this is a what about if your knee you cracking or popping anytime I work out pretty frequently. I do a lot of strength training, and if I'm doing squats, sometimes my knees will pop every time. Is that a sign of something bad?
Yeah, not necessarily. I mean, usually most sounds associated with joint movement are just structures kind of passing over one another, tendons passing over bony prominences, or bursa. Sometimes it can be air pockets. There can be a number of causes of quote unquote sounds in a joint. And I would tell you the two things that should reassure you that it's not anything concerning is, one, if it's non-painful, you can feel pretty rest assured that that's just a physiologic sound, something that is common and you don't need to be very concerned about, and or swelling. So if you notice either of those, I think, sounds can be indicators of, for instance, tears of cartilage or meniscus or otherwise, but sounds are very, very common, often benign, and usually associated with just normal structures passing over other structures, and it creates some sound.
Well, that's a bit of relief. I think I'm echoing. So that's a bit of a relief, especially for me, because this is not related to knee pain, but you guys are probably the ones to answer this. I have, which is probably the most annoying habit in the world, which is I crack my knuckles. Like I'm a big knuckle cracker. And so, people always say that you're going to get arthritis. That's going to cause you problems. So is that true? If you crack your knuckles, that you will make yourself have arthritis eventually?
I don't think so.
Good. That is good to know.
I don't think that's anything to be concerned about.
Okay, so we are talking about knee pain and knee problems. And before we wrap up, I want to make sure that we didn't miss. Is there anything that we missed that either Dr. Dewan or Dr. Davis you think is important for folks to know about before we wrap up this afternoon?
Yeah, I mean, I think, and this extends from youth to, regardless of age, practicing good joint health is really a good idea, and things, fitness and continue to be active are important, and that doesn't necessarily mean you have to be able to run marathons or play 6 hours of basketball, but staying active is very important. Psychologically, physiologically, cardiac, for so many things. But practicing good joint health is a good idea, and ways you can do that are, one, trying to vary your workouts, especially if you do a lot of high impact. It's a good idea to try to do some cross training and try to mix in some lower impact activities. It's also good to listen to your body. So, a lot of people that are very active that, maybe in their younger ages were used to pushing through pain, those injuries can add up and can, become sequential, and something that would have been benign and would have been very easy to reconcile may turn into something that's a little bit more significant. And then lastly, just practicing good health, not smoking, keeping your weight down, and eating well. Those are all things that, just like they would be for any other organ in your body, your joints also will benefit from those.
Yeah, I think keeping yourself strong and fit, which is what Aman's talking about, is really important at every stage in your life, and that will help prevent you from getting knee injuries, and that will help prevent you from being sore. And so I think having a regular exercise program and trying to be diligent with that at all stages of your life is really important.
Mm-hmm. I'm glad that you guys have brought that up, because I've been hearing this a lot lately, that the importance of exercise as preventative medicine. I hear a lot of sports medicine experts say things like, if we could bottle up the benefits of exercise and put it in a pill, everybody would want to take it because it would be doing a lot of great things for you. So I'm glad you bring that up. And we actually did have a question just come in the chat from a viewer here. So we'll get to this question. This is from Hamza, and Hamza says, I dislocated my knee. It's been over a month and I still have swelling. What is the best treatment for swelling in the knee?
Yes, I'll take this one. This is something that we see commonly in our athletes. I assume he means he dislocated his kneecap, which is somewhat a little different than a true knee dislocation where the tibia and the femur, the thigh bone and the shin bone separate. But assuming it's a kneecap dislocation, that's fairly common. And again, most of those do not require surgery. They can require several months of activity modification. Swelling is something that I think there's a number of things that can be done for that. One modality that I think is really underutilized is ice. And icing in 2022 is as simple as going to Walmart or Walgreens or what have you and getting some of those refreezable ice bags. They usually comes in a pouch, and they usually come in a series of 2 or 3, so you can change these out. But icing every single day for 20 minutes at a time, at least twice a day, I think is probably the most effective treatment. Compression can also help if you want to use an ACE wrap on top of the ice. Just make sure that you have some sort of cloth or something that's between the ice and your skin so you don't get frostbite, and ice for no more than 20 minutes at a time. But icing, I think, is really underutilized. Compression is also a great modality. And then anti-inflammatories like over-the-counter Aleve or ibuprofen can also be very helpful. And then obviously activity avoidance or pain avoidance is a good idea. Every time you're doing activities when you're trying to recover from an injury and you experience pain or discomfort, that's usually a sign that you're irritating the structures in and around your knee and creating inflammation and thus more swelling.
Okay, thank you, Hamza, and thank you, Dr. Dewan, for that. So kind of spinning off of that, do you ever recommend using heat on an athletic injury? And if so, when do you recommend icing and when do you recommend using heat?
It depends really on the nature of the injury. So, in general, when we talk about acute injuries, we want to be anti-inflammatory. And so as a general rule, for 48 to 72 hours, you want to try to use ice. And if you have any sort of inflammation and swelling, ice is really a better modality than heat, because heat will promote more inflammation and more swelling. Heat can be outstanding for certain things. For instance, chronic Achilles injuries or chronic patellar tendon injuries or certain chronic conditions of tendons or muscle where we're trying to promote blood flow and we're trying to promote healing. And in order to do that, heat can be a great modality to try to create some of that new blood flow, neovascularization, and often will feel better at the same time. And those are more for chronic type injuries or ones that are well out of that acute phase. But I think it depends on the injury and depends on the timing. But in general, when you're talking about acute injuries or things that have occurred relatively recently, you want to go with ice. And more chronic type injuries, heat can be helpful.
Okay, that is good to know. So thank you very much for that explanation, because I think a lot of folks think you're supposed to vary between, ice it for 20 minutes, then put a hot compress on it for 20 minutes. So thank you for clearing that up. And thank you, Dr. Dewan. Thank you, Dr. Davis, for joining us this afternoon to talk with us about knee problems and knee pain. Thank you for joining us and watching. If you are watching this on playback and there's something that you want to know about knee problems or knee pain and we did not answer it here, please still feel free to put that question in the chat under this video, and we will get an answer for you. So thank you for joining. And again, Dr. Dewan, Dr. Davis, thank you for your time. Guys, have a good day. Thank you.
Thanks, Barb. Can we put the phone number in the the chat.
Yes, we'll put the phone number to Penn State Health Bone and Joint Institute in the chat, so that way anybody who thinks they may need to see somebody about an injury or recurring pain or an issue, please reach out that way, and we'll get you where you need to go.
Yeah, and we're committed to seeing people as soon as we can. So there's almost always a way to get folks in quickly. So when you call, if you feel like you need to be seen quickly, be a little insistent about it. And there's usually a way to figure that out. So we want to make sure that folks can get to us as easily as they can.
All right. We will make sure they have the information they need. Thank you very much. All right. Have a good afternoon and a good weekend.
Great. Have a nice weekend.
Bye. Take care.